With the monkeypox virus now reported in Alabama, how concerned should you be? Investigative reporter Brendan Kirby has more information about its transmission.
Public health officials aren't exactly panicking, but they are recommending normal vigilance against transmission. As a rule, monkeypox isn't highly contagious like, say, COVID-19. It usually requires close skin-to-skin contact. The Centers for Disease Control and Prevention says many cases have involved men having sex with men. But health officials say anyone can contract it, even by touching objects of infected people. It can be painful. Symptoms include a rash that sometimes changes from a small bump similar to a mosquito bite to swelling, and then finally to a large rash with a small dark center. It can also come with a fever, achy joints, and swollen glands. Listen to what monkeypox patient Matt Ford told CNN.
They were at worst on more sensitive skin, excruciatingly painful.
Historically, monkeypox fatality rates in Africa have been as high as 10%, according to the World Health Organization. But more recently, the WHO says the death rate has been 0 to 3%. Dr. Bernestine Taylor, the Disease Control and Prevention Medical Officer for the Alabama Department of Public Health, attributes that higher death rate to lack of access to treatment in Africa. She tells me people in the United States generally recover at home.
It's just we're concerned in immunocompromised patients or high-risk patients, but for the general public, basically is self-limited and usually doesn't warrant any further intervention.
Alabama is one of the last states to record a monkeypox case, becoming the 43rd plus the District of Columbia. Cases nationwide jumped 40% in one day from Wednesday to Thursday, reaching about 1,470 cases.
We do have numbers that are increasing in the United States, but for this point, there's no concern, just basically for if you're not exposed to someone with a rash.
Health officials recommend taking steps to prevent the disease. Avoid close contact with monkeypox patients. Don't handle bedding, clothing, or towels that an infected person has used. Isolate anyone who has been diagnosed with the disease. The quarantine period is 21 days. If you've possibly been exposed, wash your hands vigorously with soap and water or use alcohol-based sanitizer. And avoid contact with animals that might have had the virus. Dr. Taylor says the state has been on the lookout for monkeypox since May. Some 80 people so far have been tested. All have been negative until the case in Mobile and the one announced after that in Jefferson County. To treat the illness, Dr. Taylor says the health department has sent antiviral medication to different parts of the state, including Mobile. From the News Center, Brendan Kirby, Fox 10 News.